Did you know USAID slashed key global aid programs? From malaria in Myanmar to HIV in the Dominican Republic, Trump's America First policy reshapes global aid today. But what does this really mean for the people who rely on these programs? Let's take a closer look at the impact of these cuts and how they are affecting communities around the world. In Myanmar, USAID's funding has been crucial in the fight against malaria. Clinics that once had the resources to provide life-saving treatments are now struggling to keep up with the demand. Healthcare workers who have dedicated their lives to helping others are now facing the harsh reality of having to turn patients away. The reduction in aid has led to a resurgence of malaria cases, putting countless lives at risk. According to recent statistics, malaria cases have increased by 30% since the cuts were implemented. Families in rural areas who were once hopeful about the future are now living in fear of the disease. Children, who are the most vulnerable, are suffering the most. The lack of resources means that preventive measures such as mosquito nets and educational programs are no longer available. This has led to an increase in infection rates and a decrease in overall health and well-being. Reports indicate that child mortality rates due to malaria have risen by 15% in the past year. In the Dominican Republic, the story is much the same. USAID's support for HIV programs has been a lifeline for many. These programs have provided not only medical treatment but also education and support for those living with the virus. With the cuts, many of these services are no longer available, leaving people without the care they need. The community meetings that once offered hope and solidarity are now filled with uncertainty and fear. The number of new HIV infections has increased by 20% since the funding cuts. The impact of these cuts is not just felt by the individuals who rely on these programs, but also by the communities as a whole. Government officials and community leaders are speaking out, but their voices are often drowned out by the larger political narrative. Protests have erupted, with people demanding that their needs be met and that the cuts be reversed. The struggle for adequate healthcare and support continues, and the future remains uncertain for many. In a recent survey, 70% of respondents expressed concern about the long-term effects of these cuts on their communities. As the world watches, the question remains, what will be the long-term impact of these cuts? Global aid workers and international organizations are working tirelessly to fill the gaps, but the challenges are immense. Policy discussions are ongoing, but the solutions are not yet clear. What is certain is that the lives of many are hanging in the balance, and the need for support has never been greater. Experts warn that without immediate intervention, the progress made in global health over the past decade could be undone. Despite the challenges, there is still hope. Communities are coming together and healthcare workers are continuing their efforts to provide care and support. Rebuilding is a slow process, but the resilience and determination of those affected are inspiring. The fight for global health and well-being continues, and with collective effort there is hope for a brighter future. Stories of communities overcoming adversity serve as a reminder that even in the face of significant challenges, hope and perseverance can lead to positive change.